From the Capitol in Madison, this is Wiz Politics Midday.
Hi, everybody. I'm Jeff Maris from WizPolitics.com, here with Midday, brought to you by Spectrum. I'm joined with Alex Moe. He's our WizBusiness.com editor. And Alex covered our healthcare forum yesterday, our virtual luncheon with healthcare leaders on lessons from the ongoing pandemic. Welcome, Alex.
Thanks for having me, Jeff.
So I hosted, you covered it. We had 4 prominent leaders in Wisconsin healthcare talking about the ongoing pandemic. When we first planned this thing, it was going to be looking in the rearview mirror, but of course the Delta variant and other things got in the way. So it was the ongoing pandemic and looking back and looking forward. We had the Department of Health Services Secretary, Karen Timberlake. We had Dr. John Raymond, he's head of the Medical College of Wisconsin. We had Chris Waleski, she heads up Bellin Health up in the Green Bay area. And we had Dr. Susan Turney, and she heads up the Marshfield Clinic. So one of my takeaways, one of the things that was, I thought the tone, the tenor of it was maybe a little cautious optimism, about what lies ahead. Maybe we're peaking a little bit on Delta variant, or vaccination rates keep creeping up. There's some other things on the horizon, maybe some antivirals that can help. Anyway, what was your take just on the general tenor, the tone of it all?
Yeah, I definitely agree. There was a definite sense of cautious optimism. I think that our speakers on the panel yesterday were expressing some perspectives that were hopeful about the ability of our state to come together and, get folks vaccinated, continue mitigation efforts to kind of get through this current surge and hopefully through the overall pandemic here in the near future. But of course, that is tempered with the reality of what we're seeing here, which is, this ongoing surge. And though there's some possibly, hopeful looking trends in the data here, that our panelists made a point to emphasize that we're not out of the woods yet. And I think that's important for people to understand.
Yeah. And on top of that, we have the flu season's coming up. And so I think Karen Timberlake, the head of DHS, mentioned that, vaccination is like a habit. It's a good habit. It's a good healthcare habit. And so, vaccination rates on flu vaccines has not really been that great over the recent years. And so she said something to the effect, well, if we don't improve on that, it could be a bad flu season too. So there's that. There's the danger of other variants that could emerge. And there's I think Dr. Raymond of Medical College of Wisconsin warned about how politics has creeped into all of this. And so that's not helpful. There's workforce issues. So there are problems, but I think that one of the lessons I heard from everybody was, well, we had this ability, there was this forced cooperation among healthcare systems. There's sort of a Midwest values thing coming through, like we can get through this. And, I think in some ways, it seems like Wisconsin's been able to avoid the worst, like some other states, because of some of these things, even though we're still in the middle of the pack, really, in terms of vaccination rates. Yeah, that's absolutely true. And I thought what some of our speakers said about what the pandemic revealed was really quite interesting. As you mentioned, Dr. Raymond with the Medical College of Wisconsin, just talking about how folks have been almost with the politicization of public health measures, seeing each other as the enemy, as opposed to the virus as a common enemy for us all. And obviously seeing that as a negative trend. So, and Dr. Turney as well with Marshfield Clinic also kind of highlighting the sort of the good and bad that the pandemic has sort of shown a spotlight on among people here in Wisconsin and more broadly, just the way that folks have been responding to the pandemic
with ingenuity and cooperation on the positive side, but then also with, I believe she said, the frailty of people's faith and belief in science and research. So kind of balancing those two aspects was something that was really interesting to hear about.
This workforce issue, I mean, this is a nationwide problem. And Dr. Turney of the Marshall Clinic, which covers a big swath, rural part of the state, said, well, there's been a rural healthcare worker crisis for a decade. But I mean, this is really being felt, because of the stresses, brought on by COVID, the delays in many procedures, all these kind of things have really worn down the healthcare workforce. And I think that there's, they all expressed dismay at this. What were some of the solutions that popped up, or the possible solutions that popped up?
Gosh, well, I know that Chris Walesky with Bellin Health was talking about the way that they are responding to some of these pressures on the workforce by almost having these higher expectations and asking their workers to do more. She, as the president and CEO of their health system, she said she was having to work extra time on the weekends, actually doing some patient facing care as the head of the overall organization. So even among the leadership positions, there's a sense of an expectation of just having these healthcare providers and people across the organization do more, which I think is contributing to that burnout. And as far as solutions go, that's obviously one of the biggest challenges that our panelists are grappling with.
Well, Raymond mentioned, getting people who aren't necessarily, not doctors, not just physicians assistants, but people like pharmacists, to get them be able to do more procedures, or to do more hands-on stuff other than, what we would normally think of from a pharmacist.
Yeah, that was interesting. The idea of training pharmacists to be doing, I think, physical examinations of patients is definitely something new to me and certainly interesting. And the whole concept, I think, that Chris Walesky with Bellin Health mentioned, as well as Dr. Raymond, the concept of having people work to the top of their license and almost expanding the concept of team-based care in the hospital setting, really almost stretching the workforce that they have as far as it can go within reason without diminishing the quality of care, I believe is the goal.
Yeah. Now each of these institutions have requirements for their workers to be vaccinated, and not all of them have come up to the deadline yet. But what did you hear from that? Because I remember asking Chris Walesky of Bellin Health. It's like, well, if some people find it hard to believe that healthcare workers might resist getting vaccinated, and she said, well, they're reflective of their communities at large, which I hadn't really thought of, but it makes sense. So if you're in an area where your peers or the people in your community are not high on getting vaccinated, you might not be either. But anyway, what else did you hear in terms of the vaccination rates with the requirements at these institutions?
Yeah, that was a really interesting aspect of the discussion, actually, the way that these different workforce populations are kind of responding to the vaccine mandates in different ways. Dr. Raymond with the medical college really mentioned that their workforce has been highly supportive of the mandate. And I believe he said 97% is in compliance with their policy, with 94% fully vaccinated, which is really quite high when you contrast it with, for example, Chris Walesky mentioned for Bellin Health, they're sitting at maybe the low 80%, I believe 82 or 83% of their workforce is vaccinated. And as you mentioned, that we haven't hit their deadline yet, which I believe is November 15th. But you can see there's a difference there. And really, Bellin Health like Marshfield Clinic Health System, has kind of more of a rural perspective on the type of care and communities that they are providing care to. And then on the other hand, Dr. Susan Turney with the Marshfield Clinic Health System, very much a rural care area for that. She did not provide a specific percentage on how much of their workforce is vaccinated, but she did highlight some strong resistance among their workers to the mandate. Of course, that's not everyone that works there, but it must be significant enough, because I believe she mentioned there were protests held. So I think that's a big challenge that in particular the health systems dealing with the rural areas are grappling with. Although, as our panelists mentioned, it's not quite as simple and cut and dry as just rural versus urban, though some of those factors certainly are at play.
Right. I think that there is a narrative out there about it. Rural counties are all slow to vaccinate. But I think I remember Karen Timberlake, the Department of Health Services secretary, saying there's 14 counties that she would consider to be rural in Wisconsin, where the vax rate is, higher than the statewide average. So I think that it's more nuanced than that, of course. So I think that that's something to watch out for. And, there's, one thing about it, there's no shortage of data when it comes to COVID and vaccinations and everything, the DHS and Wisconsin Hospital Association dashboards are a wealth of information. They'll keep social scientists and researchers busy for years. So, we're going to have to just keep following this, Alex. It's a continuing story. And one way for people to tap into this is by subscribing to the free healthcare report that you do every day. And you can sign up for that at wisbusiness.com. And then if you want to watch our program yesterday, our virtual luncheon, you can go to wisbusiness.com and see Alex's reporting on that, and you can link to the video. So I want to thank Alex Moe, the wisbusiness.com editor, for joining me today. And this is Jeff Mayers from wispolitics.com signing off for Midday, brought to you by Spectrum.
This has been WisPolitics Midday. For more state government and political news, visit wispolitics.com.